So I've just connected the cylinders to the teeth, and I did these two first so you can see the access holes coming out of the teeth here. And the reason why we don't do everything at once is so that we can have a good index, so we don't lose our orientation. And so after doing these two, I'm now connecting these two. And we've just done it, and I'm going to take it out and create the access holes. So this system is great. It saves us a lot of time. You'll see these two pins sticking out of the analogs here. So these are the ones that I just picked up. The head is actually made of a plastic material that's now inside the cylinder, and right now we need to remove that. So that's too small for my fingers. There we go. Right, so I'm going in from the underside to try and get an access to come out this way. There we go. And so right here, you see that we've created a hole. So this is exactly where the screw should be. I'm going to do the other one over here, and then we're going to widen this hole. Okay, so this is a slightly wider drill, and I'm just going to widen the access hole to be about this size. So just like that. And the little cap of the plastic cap that I mentioned earlier is still stuck in there. We're going to take it out later. Okay, see that? Mm-hmm. So that's the plastic cap, which is the head of the screw, like right here. Mm-hmm. And so that leaves us a really nice and clean hole. If you can get right through, you can see like a perfect cylinder.
Sure can.
There we go. Yeah, and so you just have to do it for this one right now. Okay, so we've connected the cylinders to the teeth. You can see the access holes, and I've put it back on the cast that we've made from the patient today. The pink, well, the darker pink area represents the bone and the gum tissue from the patient in surgery right now. And what I'm doing is I'm trying to fill up the gap between the teeth area down to where the patient's tissues are. So all the gap that you see will be filled up with our provisional material. And right now I'm just making sure that there's a gap between the provisional material and the soft tissue cast that you see, the dark pink area, so that I know everything is seated without any interference. So I'm just doing a check, and everything is clear from the back view and the front and the sides. It's really close here, you can't see it, but trust me, there's a tiny gap there. So I have the liquid and the powder that we're going to mix, which is the same material as what you see here, and we're going to start filling up the gap. Put it in a syringe. There we go. I've put Vaseline on my glove to act as a barrier, and then so this is hardened up and set, and I've removed the screws attaching this onto the cast, and right now I just have to remove it like that, and you can see that this is really concave, but this has to undergo lots of trimming and adjustments. So I'll be starting by trimming out the provisional to make sure that it fits well, and I'll show you the end result. So we've done the trimming, and there's a gap between the soft tissue and the prosthesis because this is actually the bone, so we don't want it to impinge too much. And contours are nice and rounded, they're not concave, they're all flat and convex. And so the next step will be to shade the gum tissue pink and characterize the teeth a little bit so the shade looks correct. Hello, so I just took this out of the light box, and we've just characterized the teeth color and put the pink on and make sure that everything's seating properly on the cast. And so now I'm ready to go back to the surgery and deliver this to the patient.